Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. So here we have a 44-year-old female complaining of burning micturition and right flank pain. This is of course indicative of UTI. And so she's prescribed Trimethoprim. However, the symptoms still persist and she ends up developing struvite stone. And as we know, struvite stone is associated with kidney infections. So the infection must have ascended all the way to the kidneys. To combat the infection, an additional antibiotic was given, which was Amoxicillin, and this was enough to subside the symptoms. So there are no more urinary symptoms. However, the patient developed new fever with diarrhea. Which of the following antibiotics or medications can be used to treat the new condition? To answer any case, first we have to break down the important notes, which are also known as the key features. We said that she was having burning micturition with flank pain, and that was indicative of UTI. She took amoxicillin, and after taking amoxicillin, she developed new fever with diarrhea. This is strongly suggestive of pseudomembranous colitis. Pseudomembranous colitis is a Clostridium difficile infection. To put it simply, we have a lot of bacteria in our GI system, especially in the colon, and once we take certain antibiotics like amoxicillin, these antibiotics will kill all of the bacteria except for some species. The left behind species like Clostridium difficile will thrive because there are no competing bacteria. So in other words, all the nutrition in the GI system will be conserved for only some bacteria. And so Clostridium difficile will thrive and cause the pseudomembranous colitis condition. The risk is highest with amoxicillin, although many antibiotics can cause this. Dehydration is very serious, so these patients must be very well hydrated. The treatment is using either Metronidazole, Vancomycin, or Vancomycin. And now let's look at the guideline. Previously, we used to treat this condition starting with Metronidazole, and that's probably what most of you have chose. However, the new guideline indicates that we start with either Vancomycin or Vancomycin. Of course, the link to the guideline will be in the description. So if we go back to the question, we now know that the patient has pseudomembranous colitis and that we start with Vancomycin or Vancomycin. And we have Vancomycin in the options. It's a very common practice in the exam to put the most common wrong answer first. So once looking at the options, the exam taker would feel confident that they have chosen the right answer. So make sure that you look at all answers. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.